Hi, Mrs. Lawson, how are you?
I'm good, how are you?
So I understand you're having some issues with your upper arm. Is it the right or the left side?
It's okay.
Okay, so we're going to be doing a little bit of soft tissue massage. And some of the risks that could come with that is you might feel maybe a little bit of pain or maybe a little bit of redness following after, but that's usually normal, so it should dissipate within a day or two. So are you okay with me performing this technique?
Yes.
Okay, and then this technique, since you're wearing this shirt, is great. It won't require you to take off your shirt, but I will drape you anyways, and then it will require skin-to-skin contact, if that's okay. Okay, perfect. And then are you comfortable lying on your back?
Yes.
Okay, perfect. So I'll have you go ahead and lie down here. Can you take your shoes off,
Oh,
please?
sure.
And then can you scooch a little bit? And then I'm going to put this pillow right here. Are you comfortable?
Yes.
And I'm just going to drape you here. And I'm just going to tuck this to your shirt so it doesn't get in the way of the massage. There we go. I'm sorry the lotion is really cold. Is that okay?
Mm-hmm.
How's the pressure?
That's good.
All right, you can move on. Let's take a look. Now, I'm gonna make her do all the things. Sorry, Kendall, we're gonna do all the
It's okay.
things. Or Samantha, sorry.
No, I stole her.
Oh, I was like, wait, what? Like,
I couldn't
Roger?
find mine.
okay, I was like, wait a second. I was like, is your really name Samantha? And we thought you threw me off. Okay, so, anyways, I'm gonna have you do all the things just so that we can review, okay? But keeping in mind that in the exam, you're not gonna have to do every single one, okay? Deal? So let's take a look at your kneading of the upper arm, please.
Nice.
Is that okay?
Mm-hmm.
Okay, and let's take a look at petrissage of the upper arm.
Is that pressure okay?
Mm-hmm.
Okay, and let's move on to kneading of the lower arm, or the forearm.
Sorry, Sarah.
Kneading.
Oh, wait.
Now I want to do that in a test. Wash.
Would you just cough really
And
loudly?
just have like sweat dripping down his Yeah. It's hard to tell unless you analyze it under a microscope. Okay, and then let's take a look at petrissage of the forearm, please.
Is that okay?
All right, let's take a look at fingertip kneading of the forearm.
I'm right-handed.
Is that pressure okay?
All right, and then can we see the forearm kind of stripping techniques? I just don't know what it's called. Splaying, forearm splay. There we go.
Is that okay? Are you okay with me going deeper?
Yeah, sure.
All right, and then let's take a look at kneading of the hand, please.
How does that feel?
Very nice.
All right, and then petrissage of the hand, please.
Yes.
Actually, I'm gonna take off a little bit of lotion. Is that okay?
All right, thanks Twinkle, AKA Samantha. Good, you guys. So, I mean, overall, I would look at, she passed. just kind of go through piece by piece and talk about each part, okay? Like I said, I mean, overall, she passed, but certainly after this, 100, okay? This is what we're looking at, because it's just like fine tuning some things. And again, you're not gonna have to do every single part, although that could help or hurt you, right? You could black out on one part. But I think the good thing about having to do different parts is that, you know, you can kind of like trash one, not that I'm encouraging this, but like, you could completely blank out on like what to do on the hand and still at least get 10 out of the points, you know, on the other parts or whatever. Like I said, I don't encourage that. But let's go through each part and talk about how we got in there. Okay, so looking at professional introduction. So in this part, did she establish her role? So she introduced the patient or introduced herself to, spoke to her patient by her last name, but then did she say who she was? No, Samantha, Twinkle, we don't know. No idea. So, is she an elementary school student? I don't know, right? So, making sure that you guys know who they are primarily. I am the physical therapist, right? Or the physical therapy student in your case, okay? You can say intern, it makes you sound like less, you know, studenty, if you want, but whatever the case, we have to make sure that the patient knows rather than, because a lot of times I have, with my aides, they're like, why can't I just see so-and-so? He's really good. Why do I have to come and see you all the time? And I was like, well, because he's the aide. Like, I'm the one with the license, so sorry to break it to you. So, yeah, yeah, well, you know. So kind of looking at that in the sense of establishing that role. So that's going to be important, right? We had our shirt tucked in, we had our badge, right? So, so we'll give her points for that. But looking at developing rapport, she didn't, you know, totally mess up the beginning. So, I mean, I've had people in the past, I don't think it's happened, I didn't hear it happen this term. It has happened in many terms where it's just more like you guys are so nervous that it's just like, dude, nobody is gonna want to work with you. Like, that's gonna be so, and it's mean to say, but like you're so nervous that like you evoke like no confidence in the sense of like, hi, I am your physical therapy student, and I'm gonna do a soft tissue technique to your arm, and it's like in your head, you're like trying to check off the box. Meanwhile, like if you think from an actual patient, would you? Yeah, totally. My hurt arm that I just had surgery on? Yeah, let's do this. No way you're touching me, right? Get the aid. So that's kind of what you're looking at, is that you've got to at least like fake it till you make it, you guys. Like get the speech down, okay? So proposes the treatment. So it was kind of iffy on that, where it was just like, what I'm gonna do is this, but you didn't really say. So I would say like, I want to do some hands-on techniques. You know, you can say soft tissue massage intervention, something like that. And that may create a little bit of discomfort and redness, but that shouldn't last very long. And then, but what's it gonna do? I didn't hear any benefits, right? So let's get those benefits down. Like, it's gonna potentially help to increase blood flow, help your range of motion. It could actually decrease your overall pain. And then kind of combo that and say, you know, are you okay with that? So some people will just say like, I'm gonna do this technique, is that okay? And yes, it is, but then you still gotta go through like your pros and cons. And then I would ask if it's okay again, because now you've just presented other factors, okay? And then, as far as the shirt goes, if you guys are wearing a shirt here, I would say you definitely want to still remove it. She pulled it up pretty high, but it's still not accessing. So tank top like that, I think is fine to keep your shirt on. Otherwise, I would say let's remove the shirt, okay? Even something like that is like kind of on the border where you still have to kind of tuck and roll a little bit. So I would say just err on the side of overexposed than underexposed in the sense of arm and shoulder, okay? Are you okay lying on your back? Did we hear that specifically?
Yes.
Yeah, okay. And then taking off your shoes, that's okay, that was kind of a last minute. Now, if we look at where her placement is on the table, the reason that we've got a pillow is so that they can move even closer to you on the table. So I would say let's move you over. So keep coming. Get pretty close to this side. Good, there. And then I'm gonna put the pillow underneath you. So roll a little bit so I can just tuck this under you, and then I'd say there. So then that way, the pillow's kind of supporting her, right? And then that way I could kind of squish in on it and get in a little closer to her arm if I needed to. So again, I would probably have taken a point off for like initial setup, but her overall body mechanics were pretty good. There was a couple places where like the weight shift or something, but if it was something where it kept coming up where it was a problem, I'd probably have to take points off on every section for body mechanics, right? Because she would be overreaching. And that's the whole point of having the table or shifting them over, is so that we don't want to injure ourselves, right? We're no use to anybody if we're hurt and we can't go to work. Looking at her effleurage, overall pretty good. She did do a step and a lunge, but it was way far back. So she did the lunge, but then she's still reaching, right? So the idea of that whole thing is to get so that your hips are kind of end up even with their shoulders, so you're not reaching. She did well and got the lunge, but then it was still a reach, okay? So making sure that you're looking at going from the fingertips themselves and then conforming to the patient's whole self, right? So I would start, it doesn't matter which one you start with, but I would start where you want to conform to the patient, right? Not keep your fingers up, because in that tension of keeping it up, your hand is more stiff and not as comfortable, right? I would also always ask, like, you're not going to get in trouble for over asking how people are, right? It's weird sometimes, but I would say err on the side of over asking if it's okay, then under asking, okay? It's 4 points on that thing. Just like each section of that in itself, if you don't have the communication, that could fail you out of this test. That sucks, that's super lame, right? So let's not have that be a thing. So you're starting here. How's that? Is that okay?
Good.
Good. I'm gonna come back. How's this? Is that okay? Great. How you doing here? Okay. Right, so again, it's weird, but like if you get in the habit of always asking, like think of it as like, this could feel fine and this is super tender. If I don't ask, they're just sitting there like, is this gonna be over soon? Okay, so probably like the first ask on each line is fine. You don't have to keep doing it, but I would definitely err on that. She did pretty well in the sense of she got on the extensors and then she almost didn't get to triceps, but she did end up diving down. That's why I had her do a couple rounds. But I would definitely say let's go here and then take that step so that, again, either my knee or my hip is pretty close so that I'm not reaching, okay? When we get to
For that line, are you still putting some traction on the arm so her shoulders aren't going up?
Yep, a little bit. So I'm gonna kind of take here, and as I'm pushing there, I'm just gonna kind of do tiny counterbalance, okay? So again, it's subtle. I'm not here, right? But I'm also not doing nothing, okay? So again, that's like a fine-tuned kind of practice thing that you have to do, okay? And different people, different size arms may require a little more, a little less, okay? So that's that little fine-tune that like, I could tell you 1,000 times, but it's just not gonna work unless you practice, okay? If we look at kneading, I'm coming in for the sandwich, right? Again, I'm forward and here, and then I'm gonna get that good counterbalance, okay? So the arm's pretty straight on this. I'm trying to drive it from my hips. And again, think of the circle, long oval. That upward stroke is gonna be kind of more center of that muscle, okay? Because again, if I start here, my upward stroke is on like no muscle, and then my recovery is on the tricep. I'd rather have your stroke on the tricep and then recovery maybe more medial or something, okay? So then I'm here. I'm gonna come just below the elbow and then come above into the shoulder. Okay? Does that make sense? Okay. Petrissage. Overall, okay, what was the key thing that she missed? Yep, so get that hand on the hip. That puts the muscle on slack so that you can pick up a little bit more. Now, making sure that you're pulling from the meat of the muscle, not going this way towards you. So again, you're perpendicular to that muscle. So we're starting up high, kind of like in the axilla, and we're lifting, pulling, and passing. Now again, not too much like swinging hips on this one, because again, what ends up happening is you guys are trying to like, I'm doing good body mechanics, right? But then that affects your hands, right? So if I'm pulling here, then I end up like ripping her skin from side to side, just like get in that squat, okay? This is a little bit less in the, you know, you can do a little dip side to side, but not like the big sway thing, okay? You guys kind of like get in trouble with the sway. So then when we're done with that, so again, we're going as high as we can to as low as we can, right? The elbow's bent, so we can't pass the elbow per se, but getting in there. She did a good job as far as technique-wise. I thought the technique was good. She didn't like dig her fingers in anybody's brachial plexus, you know, things like that. Again, inquiring, how is this going? Are you okay? You know, that kind of a thing. Oh, I don't want to lose that. My favorite pen. Okay, we're gonna straighten out here. And again, I would say if you had to go right into kneading of the forearm, so again, it might be tricky because I may not say do kneading of the forearm next. It might be kneading of the hand. So again, you guys gotta like click, where am I going? What am I doing? I will always go in the order of at least like going through all the kneading first, then I'm not gonna like flip it around and be like, hand, petrissage, then do this, right? We're still going in our depth order. But it may not be, I may have you jump from here to here. So you have to know those starts and stops, okay? But if we're looking at kneading of the forearm, I would ideally put them in a neutral. It's gonna be a little easier for you. And then that way you're just on flexors, extensors, kind of a medial lateral type of situation, rather than being here or having to be here, right? So I'm gonna start above elbow. I'm conforming. Now the hard part about this is to give that good counterbalance so their hand's not flippy floppy. Okay, so it's not this, it's this. Okay, again, something that I can tell you, but until you try it, it's not gonna click. Okay. Our forearm petrissage, she did pretty well. Only key big thing with that was what? What are we working on? And where does that insert or great. So we have to start above the elbow. So again, remember with that one, it's your inside hand. She chose to stand here, which is fine, okay? But we got to get at least one pull above that elbow crease, okay? And then the rest of it's pretty easy, just a nice good pull. Now remember with this one, we don't want to go too far down. Now make sure too, a lot of you guys are doing like sweeping. So the actual pull would be this way. I want the pull to be this way, okay? So remember, I'm pulling, I can sweep in to get more, but that actual pull is perpendicular to their structure, okay? Questions about that? If I were to do the other way, facing her, I would be here with my outside hand still holding and supporting, my inside hand coming here. But I have to kind of change my body mechanics a little bit in order to get that proper pull. Again, some people will pull this way, which you can do you won't technically get points off, but I find that it's more stressful in your wrist, okay? If we get into fingertip kneading, what was the big thing with this? There was, so you're going down. Now again, technically, right, like if I was in the clinic, like who cares? I went from down to up or up to down. In this, I gotta grade you all the same. So we have to go from proximal to distal. So it's probably be like a point off. It's not like total loss by any means, okay? It's just, again, did you practice it right? Are you telling your body to do the right thing, right? Overall, her technique looked good. Now, if you're finding that you're going to do this, so we wanna start above, if you're finding that the hand is really, or their forearm's really wobbly, I'll let you kind of sneak in and put a thumb on the forearm here, just to keep it from rolling, okay? If you're, not everybody is gonna do that, so you may not need to do that with everyone, okay? You can choose to use those 3 fingers or the 2, okay? And again, only coming down to where that bulk of the muscle is stops, right? I'm not gonna fingertip into the tendons. Now, what did we miss with that? So that's gonna be like a team of techniques on that, okay? So if you're doing fingertip kneading, I'll expect the massage to finish. Is it just getting hotter? It just feels like it's getting hotter. So sweaty. Okay. And then the splaying, or the stripping, splaying, forearm. So on this, she did pretty well with using that outside hand. I think that's fine. I think I was teaching you guys inside hand to kind of come across. She did okay. I think in this particular position, it wasn't too awkward. I think on some people, again, it can be a little bit funky because you're coming in like that. I probably won't take points off for which hand, and I'll let the other testers know that you guys can go the inside hand or the outside hand, but just keep in mind, if you guys are having to like reach far to like come in this way, if it feels weird, it's probably your body mechanics are off. So check that, okay? Our kneading of the hand, same idea. If you're on the forearm or on the hand, ideally have it so that her hand is resting, okay? It's less stuff to have to deal with. If you're lifting up here, I'm having to control ulnar and radial deviation as well as flexion extension, okay? So if they're resting, then you can at least control the deviation to some degree. Now again, this one's hard because their hand wants to move all over. So the more that you conform to their hand, the better off you're gonna be at controlling that, okay? And we're going all the way to those fingertips and back, okay? When we move on to the last one, to petrissage, we're coming up, the thenar eminences are together. We're superior, just starting a little bit above wrist. She did a good job of supporting at one hand and doing the work with the other. I think she came a little low. It looks like she did 4 and kind of got into those fingers a little bit on that last one. So we've got to really watch out for these guys. We don't want to rip fingers off, okay? And then following it as you come back up as well. And then other side. Okay? Does that make sense?